How do memory and emotion affect trauma in acute stress disorder? Imagine your mind as a busy library where every book is a memory. When a traumatic event happens, your brain quickly tags that memory as important, making sure it gets stored very vividly. During this time, your body's stress response kicks in, activating systems that flood your brain with chemicals like norepinephrine and cortisol. These chemicals help you focus intensely on the trauma, making the memory more detailed and emotionally charged. This process is part of how your brain encodes and consolidates the traumatic experience, so it becomes a strong, lasting memory. The amygdala, the part of your brain that processes emotions, works closely with memory centers during this time. It tags certain details as emotionally significant, which can cause you to remember the central parts of the trauma very clearly. At the same time, less emotional or peripheral details might fade or be less accessible. This focus on emotional core details is why people with acute stress disorder often experience intrusive memories that feel very vivid and distressing. Now, when it comes to retrieving these memories, stress can sometimes make it harder to access them later. High stress levels can impair your ability to recall memories smoothly, which might make the memories feel even more intense when they do come up. This can lead to flashbacks or sudden, unwanted thoughts about the trauma. Interestingly, the same chemicals that help encode memories during stress can also influence how you manage your emotions. For example, cortisol can sometimes help you reframe or reinterpret your feelings, but it can also make emotional regulation more difficult, especially if stress remains high. Emotion plays a key role in shaping how trauma is remembered. The amygdala's involvement means that emotionally charged memories tend to be prioritized, which can make traumatic memories seem larger than life. This selective memory process contributes to the symptoms of acute stress disorder, such as intrusive thoughts, hyperarousal, and emotional upheaval. It's important to remember that everyone's brain responds differently, and factors like individual biology, the nature of the trauma, and support systems all influence how memory and emotion interact. Understanding this complex dance between memory and emotion helps clinicians develop better approaches to treatment. For example, therapies often aim to help individuals process these vivid memories and regulate their emotional responses more effectively. If you or someone you know is experiencing symptoms of acute stress disorder, seeking professional help is essential. Remember, everyone's experience with trauma is unique, and with proper support, recovery is possible. Always consult healthcare professionals for personalized advice and care.